You know, the Affordable Care Act passage of this new law 2 years ago was a groundbreaking moment for women's health. Before health reform, our health system, our care system, was not meeting the needs of women and their families. That was certainly the case for Victoria Strong. She's a young mother who lives in my hometown of Santa Barbara, California. Victoria's daughter, Gwendolyn, was diagnosed with a rare disease when she was 6 months old. She has spinal muscular atrophy called SMA. Her care is extremely expensive, round the clock. And Victoria, her mom, lived in constant fear that Gwendolyn would reach her policy's lifetime limit, even though it was a very generous policy. And because of her pre-existing condition, she would then be uninsurable for the rest of her life. I cannot even imagine how difficult it was for Victoria, who has already dedicated her whole life to caring for her daughter, to not know if her child's basic needs would be covered in the future. And that's exactly what young mothers and parents with children with chronic conditions faced before the Affordable Care Act. The elimination of lifetime caps has given Victoria peace of mind. And that's not a small gift, to know what she now knows with certainty that her child's health care needs can be met. And that's what the Affordable Care Act was all about, fixing a broken healthcare system, fixing it for moms like Victoria, for women across this country and for their families. This law gets it right. We have to remember people like Victoria. These are real stories and real voices, real people. They're the reasons we're here. We are here to give them a voice. I'm proud of little Gwendolyn for all that she has faced in her short life. I'm also proud of her mom, Victoria, and moms like her across the country for making their voices heard. They needed the Affordable Care Act, and we passed it, and we're all going to stand strong to protect it.